Hello, I'm Dr. Lisa LaRue, I'm a GP. Along with my colleagues, we have made this film about fibroids. You may have found it as you have heavy periods or other symptoms associated with fibroids. Please see your GP to discuss this and see what treatment options may be available as a starting point. This film gives you an overview about what fibroids are, what treatment options are available, and how we can support you. You may have questions afterwards, which you can talk to your GP or consultant about. We also have a patient information leaflet on fibroids.
I'm Debbie Holloway. I'm a nurse consultant in gynaecology at Guy's and St Thomas's, and this means I specialise in the female reproductive system. I'm going to talk to you today about fibroids and what symptoms you may have. Fibroids are generally non-cancerous growths that develop in the womb. They're made up of fibrous tissue, which is an overgrowth of the muscle of the womb. And approximately between 2 and 4 women in every 10 will get fibroids at some point in their life. The exact cause of fibroids is still unknown. We know that the fibroids are linked to estrogen, which is a female hormone from the menstrual cycle produced by the ovaries. We know that some women, if they're overweight, produce more estrogen and may be more prone to fibroids. And the other group of women that are more prone to fibroids are women who are Afro-Caribbean. And again, we don't know why this might be. Often women have small fibroids that don't cause any symptoms at all and don't need any treatment. Otherwise, fibroids do shrink after the menopause when there's no estrogen around, and symptoms will get better then. In some women, they have severe symptoms that can cause an impact on the quality of life and do need treatment, such as tablets or operations. Fibroids can cause a whole range of symptoms, and not all women get all of these symptoms, but they can cause heavy, painful and prolonged periods, anemia, which results from loss of red blood cells caused by heavy periods, which can make you feel very tired and weak, bleeding in between the periods or bleeding during or after sex, pain or discomfort around sex, a bloated tummy, which can cause you to look pregnant, tummy or lower back pain, a constant urge to pass urine, and constipation. In some cases, fibroids can cause you to have problems getting pregnant. If you are suffering from symptoms, you will probably have visited your GP to discuss the problems you're having. Symptoms may be a sign of other conditions, so your GP will need to find out a little bit more about what you're experiencing. Fibroids can grow anywhere in or on the outside wall of the womb and vary in size considerably, from the size of a pea up to the size of a melon. Most women coming for treatment will have more than one fibroid and of differing sizes. Of the 3 types of fibroids, the most common are intramural fibroids, which develop within the wall of the womb. The second most common are submucosal fibroids, which means they develop inside the lining of the womb. These can grow onto a small stalk called a pedunculated fibroid. The third type of fibroid is subserosal, which means the fibroid develops on the outer wall of the womb. These can put pressure on the surrounding structures like the bladder and the bowel and intestines.
When my patients come to see me with symptoms that suggest fibroids, I may prescribe medication to help ease and manage those symptoms. These medications include hormonal treatments, which may help to regulate your periods. You may know these as the contraceptive pills, intrauterine devices, or injections. I may also prescribe non-hormonal medications such as anti-inflammatories or tranexamic acid, which may reduce your bleeding. You are also able to take these if you're trying to get pregnant. If medical management failed to improve my patient's symptoms, I would send her for an ultrasound to confirm that fibroids were the cause and send her to a gynaecologist for a consultation.
My name is Yaqub Kalaf. I'm a consultant gynecologist. I deal with fibroids all the time. And if you're referred to me, I will listen to your story, try to figure out what are the main problems that the fibroids are causing you, and then start the examination by feeling your tummy to get an idea about the size and the site or the location of your fibroids. It is helpful sometimes to use some imaging assessment. Most of the time, an ultrasound scan performed there and then would be enough. However, in some occasion, a different imaging technique called MRI would be required to assess the exact site and location. This is particularly relevant for people who had previous surgery to enable us to plan or to have a plan for your treatment that is safe and appropriate. If your examination and assessment overall indicated that you need some treatment, we will prescribe you or advise you on the appropriate treatment that is suitable for you. We take into account your age, your weight, the size, and the number of fibroids and their location in relation to your womb. And we also take into consideration your wishes to have a family in future or to have your fertility plans in general. The main surgical options are myomectomy, uterine artery embolization, hysterectomy, and transcervical resection of fibroids, which we will shortly discuss in more detail. Before surgery, sometimes we use medications to shrink the fibroid and to reduce the amount of bleeding you have during your period. The advantage of this is that it restores your blood count and make you better prepared to have the surgery with less complication. In addition, shrinking the fibroid will make the operation easier, quicker, and safer. The first surgical option that I am going to describe to you is the myomectomy, which is the operation whereby we remove the fibroids and leave the womb behind. This operation is done through a tummy cut, and this cut will be either made across when the fibroids are accessible, they are not too large, and we can deliver them safely through this kind of cut. However, if the fibroid is too large and there are too many, then it is safer to make the cut up and down, whereby we can access as many of the fibroid as possible. If the fibroids, however, are too few and small in size, and they are accessible through keyhole surgery, this will be the preferred option, where you have few small cuts and done through a camera guidance, and then that requires not a long cut and does not require long hospital stay. You will have general anesthetic for the procedure, whereby a consultant anesthetist will be there to give you safe anesthetic. You will be asleep, you will not feel any pain, and the procedure will involve the removal of the fibroids only whilst your uterus will be retained. That means that you will continue to have your period, although you would expect significant improvement in your period, and you will also retain your ability to have children. Most patients will have their problem resolved after myomectomy, where all their fibroids will be removed. However, some patients, particularly when they're young and when they start off with large number of fibroids, including some that are very tiny to remove at the initial surgery, in a few years' time, those become big and they lead to some symptoms, and they may require another procedure. After surgery, you will be spending up to 3 nights in hospital. During this time, you will feel tired and washed out due to the effect of surgery, following which you will be going home. At home, you will need some help. Your recovery period could be between 4 and 8 weeks. Some people will recover during a shorter period of time. And after your recovery is complete, you will be able to go to your normal daily activity.
I am Prudencia Jennings, and I had an open myomectomy in 2013 at Guy's and St. Thomas's Hospital. I was having right pelvic pain, and this was always prior to my period onset. And I went to my GP, and they did an ultrasound, and from the ultrasound I had a very small subserosal fibroid. And then as time went on, my period started to become heavier, and then I noticed I started to have increasing pain, and it was more generalized pain. The second ultrasound showed that I had a second fibroid, but this one was actually bigger than the first one, so it actually surpassed the first one, and I think that was what contributed to my increasing pain and heavy periods. I wanted to have a procedure that wouldn't prevent me from having children, and I think the open myomectomy was a good option for me at the time. If you're experiencing heavy period and pain, I would advise to make sure you see your GP and be persistent in getting it looked at and don't give up, don't suffer in silence, because there's a lot of help out there and there's a lot of advice out there and different treatments that's available to help. Well, I haven't had a further ultrasound to see if it has gone, but as far as I'm aware, they have removed both of them completely, so I am happy with that. I got a tummy tuck.
Hi, I'm Sarah Hutchinson. I had an open myomectomy surgery in January 2015. I wish I'd had more confidence when speaking to the earlier doctor and actually asking more questions, insisting on getting it looked at. I think I took it for granted that people would understand the impact that it was having on me, and I don't think everybody in the system did, but it's something that you feel you shouldn't be sort of saying to my boss, oh, you shouldn't go to your boss, I can't come in, my periods are so bad. That's not something that you're supposed to do. So I wish I'd asked for help and told my doctor just how severe the impact was. And I got very lucky that I saw somebody who was quite open and listening to that eventually. Once I had a medical reason for it, those conversations at work, etc., became a lot easier. I'd been through quite a lot physically, and I think women often don't give themselves a break for sort of trying to get through things. You feel like you have to just keep going, and actually it was quite a significant thing that was happening to me, and so stopping and getting help was a brilliant thing I did, and I actually feel so much better for it.
Another procedure for the treatment of fibroid called uterine artery embolization, and that is performed by one of my colleagues.
Hello, my name is Irfan Ahmed and I'm an interventional radiologist. UAE, or uterine artery embolization, is a minimally invasive procedure which basically blocks the blood supply to the fibroids. This is a specialist procedure which is done at various centres across the UK, such as Guy's and St Thomas's. UAE is a minor operation which is done through a tiny cut in the groin under local anaesthesia. Through this cut, a thin flexible tube is then advanced using X-ray guidance into the tiny blood vessels that supply the fibroids. A fluid containing grain-like particles is then injected, which essentially blocks the blood supply to these fibroids so that over the coming weeks the fibroids shrink down and starve and cease to be a problem for the patient. You'll be given medicine through a tiny cannula placed in your arm. This will include painkillers to ensure you don't feel any pain. In addition, you will be provided with some sedation, which will make you slightly drowsy during the procedure. You will still, however, be able to communicate with staff, although some of the drugs we give you may cause you to forget the procedure afterwards. You will still have periods, and UAE should allow you to maintain your fertility and to have children in the future. The possibility of new fibroids developing cannot be ruled out, particularly where the patient is a younger woman. Approximately 8 out of 10 women symptoms remain improved following this procedure. UAE usually requires a single night stay in hospital after the procedure. Some women do experience some discomfort and bruising around the tiny groin cut. In addition, some women have experienced some discharge and cramping after the procedure for up to a couple of weeks. Very rarely as well, some women do feel low and tired after the procedure, which usually resolves after a couple of weeks. Normally we recommend 1 to 2 weeks at home before resuming your normal activities.
I was on holiday and my husband was rubbing suntan lotion into my rather fat tummy, and he said, "But this isn't fat, it's all hard." And he was right, I couldn't actually get up, I had difficulty sitting and it was really uncomfortable, and I thought I had ovarian cancer. So as soon as we got back from holiday, I went to the GP and she examined me, and she was worried as well and got me an immediate ultrasound scan. The radiologist who told me, he said I had very big fibroids, but probably they'll go away after I had menopause. Now I was quite a long way from the menopause then. So I went back to the GP because she wanted to know what was going on and she was quite concerned. So she told me all about fibroids and she said I could have a hysterectomy. I did a lot of my own research before I went to see the gynaecologist. And I'd actually decided before I'd gone to see him about what I wanted, which was fibroid embolization. So I was referred to an interventional radiologist, and it was a trial because it was relatively new. He explained in great detail all about the procedure, much more detail than I would got from anybody else. and so I agreed to have it. FEMISA is a patient support group set up about 15 years ago. We don't actually advocate any particular sort of treatment, but we think choice is really, really important. And we've got a website with a lot of information on it about all the different fibroid treatments, what women's rights are, what they should be told, what questions they should ask, that sort of thing. If I were having my time over again and advising other women, when you go to your GP and you're told you have fibroids, I would ask for a referral to a gynecologist, which you'll get anyway, because they're the experts on fibroids. And they will tell you about hysterectomy and myomectomy. But very importantly, also ask for a referral to an interventional radiologist who is the expert on embolisation and MR-guided focused ultrasound, and they will be able to tell you all about that and whether you're suitable or not. I mean, most women are suitable for all of them, so don't be put off, because you would be very rare if you weren't.
When I had the scan, I wasn't very sure about the size of my fibroids. I really wish I'd asked to be shown when the scan was being conducted, but I didn't get that chance. No one really sat me down to take me through my options or what options I had until I got to see the consultant, and the consultant gave me the option of the embolization procedure. I wish I was better informed, probably at GP stage.
Another option we offer in gynecology for women with fibroids is a hysterectomy, which involves removal of the womb. After a hysterectomy, the periods will stop and the fibroids won't grow back. It will also stop you from having children in the future. At the time of hysterectomy, if the ovaries are normal, then they won't be removed, so you will not become menopausal immediately after the hysterectomy. A hysterectomy can also be performed with keyhole surgery, which allows quicker recovery for the patient. You normally stay in the hospital for 1 to 3 days. It's quite normal to feel weak and tired at first and low and emotional after a hysterectomy. A hysterectomy is a fairly major surgery. Therefore, you would need help and support at home to recover from the operation. We will also prescribe some painkillers to help you to manage the pain. We will also show you some exercises to help you to recover from the operation. Normally, after a hysterectomy, we would recommend 4 to 8 weeks recovery period at home.
My name is Beryl Christiana Romain. I had a major operation. It was a hysterectomy at St Thomas's Hospital last year, March 2015. I waited 13 years. Yes, I did. Yes, I don't regret it though, because I couldn't cope at the time thinking that I'm going to go under a needle, go under a knife. I couldn't cope with that. For those who are hellbound in using African or old wives' remedies, I will give them my story, that I've tried that. I've gone down that route, and unfortunately it did not work for me. For women who are out there who feel that no, I'm still going to try, I would say to them, you know, please do some research, do some little bit more research, because it doesn't always work. Don't feel that this is the only option. If this medicine from Africa does not work, I am doomed. It didn't work, but I had my faith still to go back to my consultant and have this operation, and it was a success.
Another procedure called transcervical resection of fibroid can be used to remove your fibroid. That is suitable only for fibroids that are pushing into the cavity of certain size, can be accessible through the natural opening into your womb, that is the cervix. The cavity of the fibroid will be like this. The fibroid will be hanging into this cavity. We will go by a special instrument and shave off this fibroid bit by bit until the complete and safe removal of the fibroid. The procedure is done under general anesthetic. You will not feel a thing, and it does not require any hospital stay, and you are expected to go home the same day. The recovery period could be up to 7 days, although most of the time it takes shorter period than this, and after which you could resume your normal daily activity.
Whether you're wondering if you have fibroids or whether you know you have fibroids and are considering treatment options, we hope this video has been helpful to you. In conjunction with the video, we've also produced a leaflet which has more in-depth information about different treatments. On the back of the leaflet is a checklist where you can mark off your symptoms to aid your discussions with your general practitioner or your consultant. At Guy's and St Thomas's, we recognise that having a diagnosis of fibroids can be quite frightening and can be quite lonely, and a good way to obtain support is with a support group. We therefore are holding support groups for women with fibroids. For more information of these, please look on our website or talk to one of the team. When you have your consultation with a consultant, you will have more specialist information specific to your case, which will aim to give you the best option for the treatment of your fibroids in line with your symptoms. We like to give you the best possible care we can at Guy's and St Thomas's. You may also come across different treatment options when looking and researching fibroids on the internet. If you have any of these specifically that you wish to discuss, then please bring this up with your GP or consultant. However, we would caution about using unregulated products off the internet. As a team at Guy's and St Thomas's, we're here to help you get the best treatment for your symptoms and your condition. Thank you for taking the time to watch this film.